set.
Hello all, my name's Tiffany Lawson. Today we're going to talk about something called Pit Crew CPR. First we're going to do a roll call.
Brooklyn.
Ben.
Mark.
Private first class, do please.
Chris.
Alana.
Pearl. Shannon. Michaela. No!
That's Hannah. So, first, Pit Crew CPR is something that a lot of you guys probably aren't aware of the actual term for it. It's something that we use in the field as first responders, whether you're on the ambulance or on the fire truck. And it's whenever we come in and there's obviously a victim who doesn't have a pulse, they're not breathing. Everyone is assigned a job. So it's kind of like the pit crew in NASCAR, where they all have either a tire change, they're topping off with fuel, whatever it is that they may be doing. We actually have the monitor. Somebody will be in charge of the monitor for the patient's rhythm, noticing if anything changes. Someone will be on chest compressions, which we rotate that out every 2 minutes so that people don't get fatigued and they get proper CPR so that we keep the heart pumping. And someone will be on the the airway here so that they can bag the victim or intubate them, whatever kind of airway that they may need to be adequate at getting this patient back to where they need to be. So Pit Crew CPR is so great because, like back in the old day, and some agencies still do it this way, which is the agency I work for, unfortunately, we are not up to doing Pit Crew CPR. So before Pit Crew CPR, when the patient would go into cardiac arrest, the crews would come in and they would just scoop the patient up, put them in the ambulance, and take off down the road to the hospital. Well, while some people might think that's great and all, an ambulance has the same things, same capabilities as a hospital has, and we're there, within quick response. But Pit Crew CPR is so great because you do everything on scene. You never move the patient. The most important thing for a patient in cardiac arrest is CPR. So whenever you go to move the patient onto a backboard, you're having to stop CPR. You have to roll them. You have to take and move everything all over the place, and that delays the care for this patient. So just think if this was your mother, your daughter, your brother, your husband, whomever it is in your family that you care about, you're delaying that care for that patient. And without the adequate care for that patient, then now they're not going to be able to come home and be fully neurologically intact, which means that they aren't going to be able to do things for themselves anymore, such as go to the bathroom. They're not going to be able to fix their own dinner anymore, or even go to a movie with you anymore, because now we've caused brain injuries. And that's not always a fun thing for us to have to live with, or for the patient and the family members to have to live with. Statistics show that in 2016, there were 350,000 out of hospital cardiac arrests. Out of those, only 12% of them came home fully neurologically intact. So that is about 37 people per hour that are dying. And of course those numbers go up every year due to the decrease in the people's health. Of course, here in America, we don't always eat the best, we don't exercise the best, so your increase for diseases go up, and that's just poor. So Pit Crew CPR is just really phenomenal, and it's something that everybody should be educated on. There's a lot of people who don't think that it's a good idea just because they think getting the patient to the hospital is the best thing for the patient. Like I said earlier, it's not, because then you're delaying the care by moving the patient, rolling them onto a backboard, and things like that. There are just so many things that we can do, and something that's great with Pit Crew CPR that you're not going to get in the hospital. In the hospital, they're not going to let you come back to see your loved one be worked on. And I feel like that's important as a provider. August will make my 14th year in EMS, so I have had many patients to be in cardiac arrest when I get there, or go into cardiac arrest in front of me. And when we do pit crew CPR, we're able to have the family to come in the room if they're comfortable with it. We can let the family see that we are truly doing everything we can for the patient, whereas, like I said, in the hospital, they don't let you come in. So there's always going to be that wonder, well, did they do this one? You know, did they do that for my loved one? Did they do that for my loved one? And I've actually let my patients' family members help with doing CPR or ventilations. As long as we make sure that they're doing it properly, then, you know, that gives the patient's family member like a peace of mind that we as crew members have truly done everything that we can to make sure that the patient gets all the care. And even at the end, if it's not the best outcome and we don't get a rhythm back on the patient and we have to call their death in the field, then the family member knows that we did everything we could. So in conclusion, I would like to say that I'm a huge advocate of pit crew CPR, and I'm hoping that this short speech has given every one of you guys an idea of what it is, and the fact that if this happens to your family and we come in and we're doing everything on scene, you know why we're doing it, because it is better for the patient. So thank you guys for your time, and I hope you enjoyed your video. We'll do a roll call now.
Brooklyn.
Ben.
Mark.
Dupree.
Chris.
Nora.
Robbie.
Pearl. Shannon.
Hannah.
Michaela.